Do you have health insurance?
I do not.
Why not?
Confusing. I don't know how to get it.
It's confusing. What's confusing about it? I know it can be confusing, especially the process.
It's a mess. It's a big mess. I'm a PhD and I don't understand it.
And language like copays, co-insurance, benefits. Do you know the difference between an HMO and a PPO?
No, not really.
Where do you go to get help?
Healthcare is heavily regulated in America. While this can ensure safety, it can also make things confusing and difficult.
It may not always be like that, but in the United States, like that's the way it is.
I got 4 insurances, and I thought I didn't have to pay out of pocket. I thought I was signing the thing for the procedure. Couldn't find out I had to pay $600 out of my pocket for them to do the procedure.
Sadly, in the United States, health insurance is complicated. It's either paid for by the government or private companies.
And there's not a whole lot of avenues out there that really tries to explain things so that people can understand and people know that they're getting the right insurance for them.
You even took a class in health insurance and you still don't understand.
Yeah, it's confusing. You know, I was on my parents' insurance and I aged out, so I had to get my own insurance, and there's just different things that are covered and different costs for different things. So it's kind of confusing when you go from insurance to insurance.
Good news is, if you need help, there's help there for you. By law, there's something called an ombudsman. No, that's not a gardener. An ombudsman is an office or a group of people who can help you with any claim or complaint you have with your insurance. You should also talk directly to your health insurance company. What's the phone number? Because they may have information for you
I'm trying to find out when is my next appointment.
about resources or any help you need that you might not know about. So have you ever tried to call your health insurance company?
No.
Because on the back of your card, it should have a bunch of information. So let's see what's on the back of the card.
Please hold while we transfer your call.
I was calling because I wanted to get a better understanding of how my deductible works for my plan.
I know health insurance can be very confusing sometimes, and it's hard to get answers when you need them. So I asked Chen, a member of our team, to call her health insurance to see if she could get her health insurance questions answered.
I'm being put on a brief hold for 1 to 3 minutes so he can figure out the answer to my question.
Now, as far as your deductible, I don't see where you met any of that. Now, as far as your out-of-pocket max, you met $130 of that, though.
Okay, so my out-of-pocket max does not go towards my deductible.
No, ma'am. But anything that meets your deductible will go towards your out-of-pocket max, of course.
So that $130 that I've already paid for, like my co-pays for different appointments, that goes towards the out-of-pocket cost, but doesn't go towards the deductible. And why? And what is the difference between the cost that will go towards the deductible and the cost that will go towards that out-of-pocket cost?
Yes, ma'am. Okay. So let me place you on a brief hold. Maybe 1 to 3 minutes, all right?
Yeah, no problem. Yeah, so it's 9 minutes and 56 seconds and I still don't have the answers to my question, y'all.
It's completely rational what she thinks. If she's spending money on her health care, it should come out of her deductible. He's having trouble explaining to her why it doesn't.
Yeah, because he has no idea.
And the reason it's not straightforward is because at each plan it's different. So you actually have to call your plan when you sign up for health insurance and get someone to explain to you what each of these terms means and what services can be applied to each one.
To make things worse, each insurance company has different rules. This makes it hard to understand why your neighbor's insurance might pay for a wheelchair but yours won't. Or maybe why one medication is covered and another is not. It's important to understand what your health insurance offers, because in most cases, it's the only way to get your healthcare services paid for.
The entire call went for about 24 minutes. And when it came to the operator, the person that assisted me, in terms of knowing the information and feeling comfortable, like, oh, okay, I trust what he's saying to me, I don't think so.
So the truth is, healthcare is a business, and insurance is a way to pay for healthcare. If you're looking for health insurance and you need help, you can also try healthcare.gov. There's a lot of information there, but it can also be a little bit confusing. So if you have specific questions and you can't find the answers online, try us here at Grapevine Health.
I won't say I feel more confused, it just makes me more so feel like it's a scam. That's truly how I feel.
I'm Dr. Lisa with Grapevine Health, and we'll see you on the street.
The benefits of it don't seem to be benefiting.